Premature ejaculation, or PE, is a common sexual concern where a man ejaculates sooner during sex than he or his partner would like. This can happen before, during, or just after penetration, and it often leaves both partners feeling frustrated or unsatisfied. It's important to know that PE isn't defined by a specific number of minutes, but rather by a lack of control over ejaculation and the emotional distress it can cause for one or both partners. Many men experience feelings of embarrassment, guilt, or even shame, but it's crucial to remember that PE is a recognized medical condition and nothing to be embarrassed about. It's much more common than most people think, and it can affect men of all ages and backgrounds. There are two main types of PE. Lifelong PE, which starts with your very first sexual experiences and tends to be persistent, and acquired PE, which develops later in life after a period of normal sexual function. Both types can be distressing, but the good news is that both are treatable, though the treatment approach may differ depending on the cause and individual circumstances. When diagnosing PE, doctors typically look for three main things: ejaculation that happens within about a minute of penetration, an inability to delay ejaculation during most sexual encounters, and significant personal distress or avoidance of intimacy as a result. If you recognize these signs in yourself, you might be dealing with PE. Remember, you're not alone, and help is available. Recognizing the issue is the first and most important step toward finding effective solutions, improving your relationships, and regaining your confidence in the bedroom. Premature ejaculation, or PE, affects more than just a man's sex life. It can deeply impact self-esteem, relationships, and overall mental health, often leaving men feeling embarrassed or inadequate. The anxiety and frustration that come with PE can create a difficult cycle where worrying about performance actually makes the problem worse over time. Men may start to avoid intimacy altogether, which can lead to emotional distance and a lack of closeness with their partners. Partners might feel neglected, confused, or even blame themselves, which can strain communication and trust within the relationship. Over time, this emotional strain can lead to isolation, depression, and a tendency to avoid sexual situations entirely, making things even harder. The stress and worry don't just stay in the bedroom, they can spill over into daily life, affecting mood, focus, and even work performance. It's important to remember that these feelings are valid and incredibly common, and that many men experience similar challenges. Addressing PE isn't just about improving sex, it's about boosting your confidence, happiness, and overall quality of life. Seeking help can restore both self-esteem and connection, helping men and their partners feel closer and more supported. PE can be caused by a mix of psychological and biological factors. Early rushed sexual experiences, stress, and anxiety can create lasting patterns. Relationship issues or lack of emotional intimacy may also play a role. Biologically, hormone imbalances, low serotonin, or heightened sensitivity can contribute. Sometimes infections or genetics are involved. Erectile dysfunction can also lead to rushing and PE. Understanding the cause, psychological, physical, or both, helps guide treatment. A doctor can help identify what's behind your experience. There are several effective ways to manage premature ejaculation, and taking the first step can make a big difference in your confidence and relationship satisfaction. Techniques like the stop, start, and squeeze methods are simple but powerful. By pausing or gently squeezing the penis before climax, you can gradually learn to delay ejaculation and gain more control over your body's response. Strengthening your pelvic floor muscles with regular Kegel exercises can also help you last longer. These exercises are easy to do at home and can be incorporated into your daily routine for lasting benefits. Using thicker condoms is another practical step. They can reduce sensitivity, making it easier to control ejaculation and enjoy intimacy without worry. Open and honest communication with your partner is essential. Sharing your feelings and working together relieves pressure, builds trust, and turns intimacy into a team effort. Remember, practicing these techniques takes patience and persistence. Progress may be gradual, but every small improvement counts and can boost your confidence over time. If self-help strategies aren't enough, don't hesitate to seek professional support. Doctors and therapists can offer medical treatments or counseling tailored to your needs. Treatment options include topical creams to reduce sensitivity, prescription medications, or therapy to address anxiety and stress that may contribute to PE. Taking positive action is the key to improvement. With the right steps and support, you can make meaningful changes and enjoy a more satisfying intimate life. If you're struggling with PE, know you're not alone. Millions of men experience this. The stigma keeps many silent, but help is available and effective. Acknowledging the issue is a courageous first step. Progress may take time, but every step counts. Your worth isn't defined by sexual performance. If needed, reach out to a doctor or therapist. They're there to help, not judge. Taking control of your sexual health is part of overall well-being. With support and the right strategies, a satisfying sex life is within reach.